Good afternoon. This is All India Radio. I'm Tanvi Taneja and with me is Anita Anand with the Midday News. The headlines. Finance Minister Nirmala Sitharaman says $3.9 billion dispersed to more than 320 million people to provide swift, timely and targeted assistance. IMF proposes to double its emergency financial assistance to countries battling COVID-19 outbreak. Health Minister Dr. Harshvardhan interacts with WHO, discusses measures being taken for containment of COVID-19 in India. Centre and state governments taking all necessary steps to contain COVID-19. And Bihar government launches door-to-door screening in 8,000 villages of 4 districts to detect COVID-19 cases. India today stressed the role of finance ministers and central bank governors of G20 countries in safeguarding the lives and livelihood of people while maintaining macroeconomic stability in a sustainable manner in the backdrop of COVID-19 pandemic. In her intervention at the virtual session of the second G20 Finance Ministers and Central Bank Governors meeting, Finance Minister Nirmala Sitharaman shared the measures taken by the Government of India to provide the vulnerable sections with swift, timely and targeted assistance. She said within a couple of weeks, India has dispersed financial assistance amounting to $3.9 billion to more than 320 million people so far. She informed the meeting that the dispersal is being done with a special focus on direct benefit transfer through digital technology so that the exposure of beneficiaries to public places is minimal. She told the finance ministers and central bank governors that India is now reaping the benefits of the far-sighted measures of financial inclusion, which are part of the pioneering reforms carried out by Prime Minister Narendra Modi. Ms. Sitharaman also said that the monetary policy measures undertaken by the Government of India, Reserve Bank of India and other regulators have helped defreeze the market and catalyze credit flows. These measures include liquidity support of $50 billion, regulatory and supervisory measures for credit easing, relief on debt servicing through moratoriums on installments of term loans, easing working capital financing and deferred interest payments on such financing. She said the G20 plan to combat COVID-19 will guide individual and collective actions of the G20 members in responding to the pandemic in short and medium term. The International Monetary Fund has said that it supports India's proactive decision of imposing a nationwide lockdown in its fight against coronavirus. Chang Yong Ri, the director of IMF's Asia and Pacific Department, said that the Indian government implemented a nationwide lockdown despite economic slowdown, and IMF supports India's proactive decision. On March 25th, India entered a 3-week lockdown which was slated to end on April 14th. The lockdown was extended then till May the 3rd. Talking about the impact of coronavirus on economic growth in Asia-Pacific region, he said, there is hope in 2021 if containment policies succeed. Noting that this is not a time for business as usual, Ri said that Asian countries need to use all policy instruments in their toolkits. In doing so, policy trade-offs will be inevitable and will depend on policy space. Spelling out a set of recommendations for the countries in the Asia-Pacific region, Ri said the first priority is to support and protect the health sector to contain the virus and introduce measures that slow contagion. Observing that the pandemic is also affecting the functioning of financial markets, he urged countries to use monetary and macroprudential regulations flexibly to provide ample liquidity, ease financial stress of industries and SMEs. The IMF has proposed to deploy its full $1 trillion lending capacity to support countries battling COVID-19 outbreak, describing the COVID-19 pandemic as a crisis like no other. International Monetary Fund head Kristalina Georgieva on Wednesday said The world is now in the worst recession since the Great Depression. Georgieva told reporters at the start of the first ever virtual annual spring meeting of IMF and the World Bank in Washington about its plans to double the emergency financial assistance. The IMF board has already approved debt relief for 25 of its poorest members. IMF chief expressed satisfaction that during the G20 finance ministers' discussion, there was unanimous support for the fund to raise more capacity for concessional funding of poor countries.
Health and Family Welfare Minister Dr. Harshvardhan held an interactive session through video conferencing yesterday with senior officials and field officers of the World Health Organization (WHO) on the measures being taken for containment of COVID-19 in India. Exhorting the WHO officials, Dr. Harshvardhan said, "We have to work together to eradicate this virus as we eradicated polio and smallpox earlier." He said we can and we will defeat this novel coronavirus. He said WHO is an important partner in our fight against the COVID-19 and India really values guidance and contributions made by WHO in containing spread of COVID-19 across the country. In the meeting, deliberation was held on further strengthening the partnership and the measures that can be taken at the field level to further ramp up the response. He said that India was first to respond to COVID-19 and stands on a better footing than the rest of the world because of the valuable and sincere services of our corona warriors. He said we are able to check this enemy through community surveillance, issuance of various advisories, cluster containment and dynamic strategy. The minister appreciated the leadership of the Prime Minister Narendra Modi as he is very receptive and accommodative to the suggestions given by experts from time to time, which in turn has led India in handling the bull of COVID-19 by its horns. He said India was able to check spread of the virus due to community surveillance, cluster containment and dynamic strategies.
Right now, we are quite well placed in the sense that we know our enemy. We also know where our enemy is. And the talk about these hotspots is, I think I must congratulate our surveillance people, our IDSP people, our WHO people, all those who are involved in this and particularly all our state governments, that we have been able to pinpoint where the virus is right now.
Praising India's response to COVID-19, the Regional Director, WHO Southeast Asia Region, Dr. Poonam Khetarpal Singh said, despite huge and multiple challenges, India has been demonstrating unwavering commitment in its fight against the pandemic. Centre has released the revised guidelines for the second phase of lockdown. A series of directives have been put in place to ensure a strict compliance of the lockdown. Our correspondent takes a look at the directives issued for the financial sector.
On 25th March, when the lockdown was enforced across India, 43 patients were cured, of which was 7% of the total 606 cases. This figure has increased to 11.26%. Health and Family Welfare Ministry data reveals that the highest success rate of 91% has been recorded in the Andaman and Nicobar Island. In Goa, the recovery rate is 71%. Ladakh has 59%, followed by Kerala, which has recorded 54% recovery. In Kerala, 211 patients have been cured so far. Bhupen Singh, AIR News, Delhi.
Revised guidelines issued by the centre to be followed in the second phase of lockdown have come into effect from today. It has allowed certain relaxations in the notified services from 20th of April in areas without hotspots. A series of directives have been put in place to ensure strict compliance of lockdown. Here is a look at the directives to be followed at workplaces.
All workplaces shall have adequate arrangements for temperature screening. Sanitizers should be made available at convenient places. Every workplace shall have a gap of 1 hour between shifts. Lunch breaks should be staggered. Staff should be sitting at a distance of 1 meter apart to follow social distancing norms. Professionals above 65 years of age can work from home. People with pre-existing health conditions like diabetes, blood pressure, kidney-related issues may be allowed to work from home. Parents of children below the age of 5 shall also be asked to work from home. Use of Arogya Setu mobile app should be encouraged for all employees. All organizations have been directed to sanitize workplaces between shifts. Large meetings have been prohibited. Stay safe and stay tuned to AIR News for the latest. Anand Chaturvedi, AIR News, Delhi.
The government also issued guidelines for print and electronic media. Our correspondent takes a look at the series of directives issued to ensure a strict compliance of lockdown in office and other establishments.
As per the guidelines, print and electronic media, including broadcasting, DTH and cable services, has been allowed. Data and call centers will be allowed for government activities only. Government-approved common service centers will be allowed at Gram Panchayat level. E-commerce companies have been permitted to operate. Vehicles used by e-commerce operators can apply with necessary permissions. Courier services, cold storage, private security services, hotels accommodating people stranded due to lockdown have been allowed to operate. Service provided by self-employed persons has been allowed, like electricians, IT repairs, plumbers, motor mechanics and carpenters. Anupam Mish, AR News, Delhi.
A total of 11,933 confirmed cases of COVID-19 have been reported in the country so far. Out of these, 1,343 patients have recovered and have been discharged from hospitals, while 392 patients have died. Briefing media in New Delhi, Health Ministry officials said that the districts of the country have been classified into three categories: hotspot districts, non-hotspot districts, and green zone districts. Hotspot districts, he said, will be those where either large number of cases are being reported or where the rate of growth of COVID-19 cases is high. Non-hotspot districts will be those where lesser number of cases are being reported, and green zone districts will be those where there is no COVID-19 case. The official also informed that so far 170 hotspot districts and 207 non-hotspot districts have been identified.
देश के हर जिले उसको हॉटस्पॉट डिस्ट्रिक्ट्स, नॉन हॉटस्पॉट डिस्ट्रिक्ट्स लेकिन वहां पर केसेस रिपोर्ट हो रहे हैं, और ग्रीन जोन डिस्ट्रिक्ट जहां पर की कोई केसेस नहीं आए हैं उसमें बांटा गया है. हॉटस्पॉट डिस्ट्रिक्ट का मुख्य क्राइटेरिया है वह जिले जहां पर या तो ज्यादा केसेस आ रहे हैं या दूसरे शब्दों में कहें तो डबलिंग रेट ऑफ केसेस वहां पर कम है.
The official said the Ministry of Health has also issued detailed directions to states regarding lockdown, which has been extended to the 3rd of May. He said districts have been told to set up dedicated COVID-19 hospitals, health centers and COVID care centers. Districts have been told to promote proper pharmaceutical and non-pharmaceutical interventions and to orient all staff involved in infection control practices and proactively train the relevant staff in clinical management. The official also informed that special teams working in containment zones will do contact tracing, and house-to-house survey and health facilities in buffer zones will be oriented, and people facing SARS and influenza-like symptoms will be tested there. He said they have asked districts to formulate district-level crisis management plan for COVID-19, and containment plan has to be implemented uniformly in the whole nation. The Health Ministry official reiterated that there is no community transmission in the country so far. The Home Ministry official said that the ministry has issued an order today making relaxations regarding essential services in areas which are not hotspots or containment zones. He said they have to, however, ensure that lockdown measures are being followed and some prerequisite steps are being taken to ensure social distancing. He said supply chain of essential goods and services and shops selling these goods can continue to function so that citizens do not face any problem.
भी जिला अधिकारी है उन सभी को कहा गया है कि जैसे कि मास्क पहनना अनिवार्य है, सोशल डिस्टेंसिंग रखना अनिवार्य है, उनकी अनुपालना सख्ती से होगी. उसका अगर कोई उल्लंघन होता है तो उस पर पेनल्टी जारी की जाएगी. और दूसरी बात ये कही गई है कि जितने भी औद्योगिक या वाणिज्यिक या और भी कार्यस्थल है वहां पे एक स्टैंडर्ड ऑपरेटिंग प्रोटोकॉल जो सोशल डिस्टेंसिंग की दृष्टि से बनाया गया है उसकी अनुपालना होना आवश्यक है.
The official said that there is no restriction on functioning of any component of the health system during the second phase of lockdown. He said work of Manrega will be allowed to take place during the lockdown period and proper social distancing norms should be followed. He said this has been done in order to encourage the rural economy.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Finance Minister Nirmala Sitharaman says $3.9 billion disbursed to more than 320 million people to provide swift, timely and targeted assistance. IMF proposes to double its emergency financial assistance to countries battling COVID-19 outbreak. Health Minister Dr. Harshvardhan interacts with WHO, discusses measures being taken for containment of COVID-19 in India. Centre and the state governments taking all necessary steps to contain COVID-19. And Bihar government launches door-to-door screening in 8,000 villages of 4 districts to detect COVID-19 cases. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
The centre and state governments across the nation have stepped up efforts in the fight against COVID-19. Steps have also been taken to ensure testing and quarantine facilities. Measures have also been taken to provide all essential commodities during the nationwide lockdown. Bihar government has launched door-to-door screening today in 8,000 villages in 4 districts to detect COVID-19 cases. Principal Secretary of the State Health Department, Sanjay Kumar, said that this is being undertaken to contain the infection. Mr. Kumar said villages where people have come from foreign countries between March 1st to 23rd of March will be screened. The screening will be completed till April 24th. The survey is being done on the lines of Pulse Polio Immunization Campaign. A 2-member team along with questionnaires will meet over 200 persons every day and collect data regarding corona. During the screening, if any suspected person is detected, then they will be sent for further health check-up. Door-to-door screening is already being done within 3-kilometer radius of places where positive cases have been found. These include Siwan, Begusarai, Nawada and Nalanda districts. In Gujarat, the total number of COVID-19 cases rose to 766 yesterday. 46 fresh cases were reported from Ahmedabad, 7 from Anand, 6 from Rajkot and 5 from Vadodara among others. Total cases in Ahmedabad have gone up to 450. Looking at the increasing number of cases in Ahmedabad, country's largest coronavirus care facility has been set up in the city. The facility, which has been created in the hostel campus of Gujarat University, will ease the load of the rising number of patients in government hospitals. We have a report.
Ahmedabad Municipal Corporation has readied the country's largest COVID-19 care center, which has a capacity to accommodate 2,000 patients. The center is equipped with a library, yoga and indoor game facility for the patients. Ahmedabad Municipal Corporation Commissioner Vijay Nehra said each patient admitted at the center will be provided with separate kits for personal care. He said medical teams will examine the patients twice a day. AMC has also started intensive checking of sanitation workers, homeless and construction laborers to check the spread of coronavirus. Aparna Khoot, AIR News, Ahmedabad.
105 fresh cases were reported in Gujarat, taking the total positive cases to 871. 3 deaths were reported in the state, taking the total death toll to 36.
Karnataka Chief Minister B.S. Yediyurappa inaugurated the COVID-19 testing mobile van in Bengaluru today. The van, fitted with the testing booth, will be used to collect throat swab of suspected coronavirus cases in all the municipal wards of Bengaluru. The Bengaluru South Member of Parliament, Tejasvi Surya, has extended financial support to the project, and Rajiv Gandhi University of Health Sciences has provided technical support. The Chief Minister also launched today Naliona Kaliona YouTube channel for children designed by the Primary and Secondary Education Department. The far-flung located Union Territory of Andaman and Nicobar is leading the battle in containment of the spread of coronavirus among the local residents. With the innovative idea of Dr. P. Vijayachari, Director RMRCICMR, Port Blair, the territory has pioneered pool testing in the country and now conducting highest number of sample tests, around 2,500 tests against 1 million population. By adopting this method, testing capacity has increased by 5 times and now 100 tests are being conducted per day. The testing lab, RMRCICMR, Port Blair, is continuing the pool testing, and as on today, it has conducted tests of 1,000 samples, the highest in the country. Drawing the attention of the ICMR HQ Director at other regional ICMR institutions in the country to conduct pool testing on 13th of April. 11 confirmed cases appeared in ANN Islands, out of which 10 cases have been recovered. The recovery rate of the islands is 90.91%, which is also highest in the country. Moreover, no positive case of COVID-19 appeared in the Union Territory after 7th of April. In Madhya Pradesh, after many new patients reported in Indore, Bhopal and some other districts, the total number of patients in the state rose to 938. So far, 53 have died of the infection, while 64 have recovered till yesterday. Meanwhile, to control and manage the pandemic, 100 nursing students of government, BSc Nursing and GNN training centres have been deployed in Bhopal and Indore districts till 30th of June by the state government.
Commissioner Public Health and Family Welfare Faiz Ahmed Kidwai informed that these services have been taken under asthma and will be purely temporary basis. These nursing students will work under the Chief Medical and Health Officer. Each selected nursing student will get honorarium of Rs 20,000 per month during this period. Transport, food and lodging will also be provided by the department. Apart from that, all necessary safety measures including personal safety equipment PPE will be made available to these nurses. On the other hand, 9 laboratories have started working in the state to check the coronavirus infection. Officials informed that if required, arrangements have been made to send samples to Delhi for testing by special aircraft. Sanjeev Sharma, AIR News, Bhopal.
The number of corona-infected persons in Rajasthan has gone up to 1,101, with 25 new cases coming to light today. The Health Department informed that 157 infected people in the state are now free from the virus. Out of these, 82 patients have been discharged from the hospital.
The Ramganj area of the capital Jaipur is worst affected, where 483 cases have been reported so far. The administration has left no stone unturned to contain the infection in this area. The administration is now working on a new strategy, dividing worst affected 1 kilometer area into 13 zones, and RAC companies have been deployed there. Free ration is being provided to 8,000 homes in this area. Meanwhile, the state government has decided to implement the modified lockdown from April 21st in the state. Chief Minister Ashok Gehlot has directed to open necessary government offices in a phased manner. Jitendra Dwivedi, AIR News, Jaipur.
Kerala continues the trend of containing COVID-19 spread in the state. It has reported just 1 new positive case and 7 recoveries. A report.
From being the epicenter of India's COVID-19 fight over 3 months ago, Kerala marks a sharp decline of the outbreak in the state. Kerala is reporting more recoveries than new cases over the past week, flattening the COVID-19 infection curve in the state. Out of 387 total reported cases, 218 people recovered so far. Presently, there are 167 active cases in the state. Kerala has over 97,000 people under observation now, which was more than 1 lakh for a month till a day ago. The Union Health Ministry has identified 6 districts and some regions of Wayanad in Kerala as COVID-19 hotspots and listed them in the red zone category, whereas Kozhikode is the only district in the green zone in the state. Mayusha for AIR News from Thiruvananthapuram.
According to the latest tally, 165 new cases were recorded in the last 12 hours in Maharashtra. The total number of COVID-19 positive patients in the state has jumped to 3,081. However, Mumbai recorded 35% fewer cases and only 2 deaths, the lowest in last 11 days. More from our Mumbai correspondent.
Today too, police had a harrowing time with people going on morning walk despite strict lockdown orders. In Pune, police made the morning walk offenders do yoga on the road. In Mumbai, people were seen making rush at the vegetable markets at Bhaikhala, a rather crowded area in Mumbai. After the police stopped vehicles from entering Mumbai, vegetable vendors were seen selling vegetables near the Octroi post, while APMCs are being opened in phased manner at some places across Maharashtra where COVID-19 positive cases are less. In Thane, the administration has closed the main wholesale market in order to maintain social distancing. Now, new wholesale markets would be opened at 17 places in 9 wards of the city. Sonali Ghadiyar Patil, AIR News, Mumbai.
The Mumbai police have arrested a total of 11 persons, including a journalist, in connection with the crowd of migrant labourers which had gathered in suburban Bandra. The police have registered 3 cases in connection with the incident so far. In the first case, registered against the mob of around 800 to 1,000 persons for unlawful assembly, rioting, violation of prohibitory orders during the lockdown. In second offence, police arrested Vinay Dubey, a resident of Airole in neighbouring Navi Mumbai, for promoting disharmony, enmity or feelings of hatred between different groups. Dubey had allegedly posted a video on Facebook and comments on other social media sites seeking train services for taking stranded labourers to their home states. In the third case, news channel journalist Rahul Kulkarni was arrested for spreading misinformation over his report that the government was thinking of starting Jan Sadharan train services for migrants, which allegedly led to the gathering of the crowd. Kulkarni and 9 others will be produced before a court on Thursday.
Gram Panchayats across the country are taking various measures to check the spread of COVID-19 pandemic in rural areas. Panchayati Raj Ministry is closely coordinating with state governments, district authorities and Gram Panchayats to ensure that there are no violations of lockdown and social distancing is being followed. In Kerala, 304 community kitchens have been started in panchayats and municipalities with the help of local self-help government institutions. Out of these, 1,100 community kitchens work in convergence with Kudumbashri, which is a state women empowerment program. In Meerut division of Uttar Pradesh, around 20,000 migrants have been identified in all 6 districts. A total of 700 quarantine centres with food and lodging have been set up. In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, President of Public Health Foundation of India, Dr. K. Srinath Reddy said that lockdown is a very effective step in slowing down the rate of transmission of COVID-19 infection.
Lockdown measures have been very effective in markedly slowing down the rate of transmission of the virus and reducing the number of potential new cases. They have also been very helpful in providing time for our health and social system to build up outreach and efficiency to handle the problems created by the coronavirus epidemic. It has also built in a great deal of social solidarity across the country.
Talking to AIR News, Dr. Sanjay Pandey assured people not to be scared of the spike in the number as we are faring better than many other countries.
जैसे जैसे कोरोना का चक्र बढ़ रहा है, टेस्टिंग ज्यादा हो रही है। टेस्टिंग ज्यादा होने की वजह से मामले ज्यादा सामने आ रहे हैं। यह नंबर कोई बहुत ज्यादा ऐसी कोई भयावह स्थिति प्रस्तुत नहीं करता है। पहले 300 मामले आ रहे थे, 400 आ रहे थे, 500 आ रहे थे, अभी 1000 आ रहे हैं। अगर आप इटली, फ्रांस, यूएस से कंपेयर करें तो वहाँ हर दूसरे दिन मामले डबल हो रहे थे। तो उससे अगर हम तुलना करें तो हमारे मामले अभी भी काफी कम हैं।
Farmers from Chhatarpur MP thanked Prime Minister for amounts received under the PM Garib Kalyan package. He said it is helping them a lot during the lockdown.
मैं स्वामी प्रसाद पाठक मध्य प्रदेश जिला छतरपुर ग्राम भरगवा से। प्रधानमंत्री जी, आपने अच्छा सराहनीय काम किया। सम्मान निधि का पैसा अधिकतर किसानों को मिल चुका है एवं गैस के सम्मान निधि भी आ चुकी है खातों में।
Najma Begum from Bidar, Karnataka received benefits under the PM Jan Dhan Yojana. She thanked the government for its efforts to mitigate the impact of the lockdown.
नजमा बेगम लालवाड़ी बिदर। प्रधानमंत्री के 500 रुपये मिले, घर में कुछ भी नहीं है, टाइम पैसे डाले, बहुत मदद हो रही उनकी।
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Dr. Naresh Gupta, senior physician, will participate in the discussion. Listeners can ask questions to the experts on the toll-free telephone number 1800-115767. You can also ask questions on the telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:25 p.m. onwards. The 41 Pakistani citizens stranded in India due to the lockdown to contain COVID-19 will leave for their country through the Atari Wagah border post today. The Pakistan High Commissioner in Delhi has requested the Ministry of External Affairs for assistance for facilitating their movement. And now, before we end the bulletin, here are the headlines once again. Finance Minister Nirmala Sitharaman says $3.9 billion dispersed to more than 320 million people to provide swift, timely and targeted assistance. IMF proposes to double its emergency financial assistance to countries battling COVID-19 outbreak. Health Minister Dr. Harshvardhan interacts with WHO, discusses measures being taken for containment of COVID-19 in India. Centre and state governments taking all necessary steps to contain COVID-19. And Bihar government launches door-to-door screening in 8,000 villages of 4 districts to detect COVID-19 cases. And for details of these stories and more, you can log on to our website www.newsonair.com. And with that, we end the Midday News.